So Barbara, you're the manager of the Dimbleby Cancer Care Centre. Tell me a little bit about it.
The services we offer are cancer drop-in information services, and we've got a drop-in on this site at St Thomas's and another one at Guy's, whereby the healthcare professionals can actually talk through with patients about the treatment options that there are, what cancer is going to mean for them, and what's available for them, basically. And then we've got a psychological support team, which offers the full range of psychological support. So we've got psychiatry, psychology, psychotherapy and counselling. And then we've got a complementary therapy team who offer aromatherapy, massage, reflexology, relaxation, and they can do that as an outpatient or as an inpatient and also on the chemotherapy units. We're talking about several thousand to actually come through the doors, you know, over a year.
Yeah. And over the years, do you think the needs of patients changes?
The needs are very similar, I think, as I don't think they particularly change. I think there's more awareness now from the public, and I think the public probably are more sure in their own mind also what they want.
And the centres offer support to the families of cancer patients as well, don't they? Why do you think that's important?
Although the patient's the one who's actually going through the treatment, that has to have a knock-on effect on the family as well, especially if the patient happens to be the wage earner, or the person who nominally would have been head of the family before. That can have quite an impact financially or, you know, just on family dynamics. And certainly if the patient is terminally ill, then there's a huge amount of dynamics going around about the acceptance of, you know, the end of that person's life.
And what sort of feedback do you get from the people who use your services?
Luckily very positive, which is nice. On the whole, I mean, patients, especially with the complementary therapies, are always delighted that they're getting something that's really nice being offered to them. Yeah, being spoiled. That you know, they can just lie there and have something really lovely done. That they don't actually have to actively do anything. That there's nothing unpleasant about it, as there are with some of the other treatments that cancer patients have to go through. That it's just a really feel-good factor, you know, pleasant treatment.
Yeah. Do you think it's important in the future to try and take these sorts of services out of the hospital environment? I mean, patients must see enough of hospitals as it is with treatments and this sort of thing.
I think it would be ideal, yes. I mean, I think at times there are reasons, obviously, why patients have to come back into the hospital, but ideally, if we could take it out into the community and possibly into the patient's home, that would be, you know, absolutely fantastic. Because there are a number of patients who actually do miss out on the service because they are housebound or bedbound or whatever. But of course that is a huge resource. I mean, you would need really large teams to be able to provide that sort of service.
Is this something that you will be looking at for the future then?
Certainly we would like to extend our hours. We would like to offer eventually a 24/7 service because we're aware that hospitals are 24/7 and we only offer what is equivalent of an outpatient service at the moment. And yes, ideally we would like to do home visiting and possibly set up areas in polyclinics or GP surgeries and things like that, so that people could actually come in if that was more local to them.